And now EMERALD study is the very first phase 3 randomized trial, leads to the single agent ESR1 targeting agent elacestrant's approval. So in this trial, patient received at least 1 line of prior endocrine therapy, including CDK4/6 inhibitor, up to 1 line of chemotherapy, were randomized to receive elacestrant at 345 milligram per day versus standard care, which is fulvestrant or AI. And you do notice that, this is FDA approved, but at initial analysis, there seems to be a very modest benefit, but further dissecting of the data, obviously the population who had longer prior CDK4/6 inhibitor exposure, defined by at least 12 months, seems to derive a much significant progression-free survival benefit of 8 months versus the 2.1 months in the control arm.